Hi, I'm Dr. Danielle Cullen, an emergency medicine physician at Children's Hospital of Philadelphia and co-associate director of implementation science at Clinical Futures.
Hi, I'm Rachel Brown, a clinical research program manager at Policy Lab and Clinical Futures at Children's Hospital of Philadelphia.
We're here to talk about the key findings from our study, Approaches to Identifying Social Needs, the SECURE RCT, recently published in the journal Pediatrics. Screening for social risks like food or housing insecurity has become more prevalent in healthcare and can lead to referrals for families to get help. But research shows that screening doesn't always match who actually wants or uses resources. Some families hesitate to respond to screening tools because they fear stigma, negative consequences, or they simply don't want to disclose that personal information. To better understand this, our team of researchers at Clinical Futures and Policy Lab led the SECURE study, a large, multilingual, randomized control trial to test how different social assessment approaches affect families' desire for and use of social resources.
From April 2022 to August 2023, nearly 4,000 caregivers in an emergency department and 2 pediatric primary care clinics were randomly assigned to one of 3 groups: a standard social risk screener, a resource menu where caregivers could pick the type of resources they wanted without needing to disclose social risk, or no assessment at all. Everyone had access to electronic, zip code-specific, searchable resource information and the option for phone-based, personalized navigation. We looked at whether caregivers wanted resources, whether they used and shared an electronic resource map, and whether they engaged with navigation support, checking in again 30 days later. The result? Caregivers randomized to the resource menu were nearly 10% more likely to say they wanted help than those given the standard screener. And for those who preferred a non-English language, the effect was even stronger. Caregivers were 2.7 times more likely to request resources when offered the menu. In short, letting families choose resources without forcing them to disclose sensitive risk information identified more caregivers who wanted help.
What does this mean for pediatric care? This study supports a needs-based, tiered approach, using a resource menu so that families can self-identify what they want, providing electronic resource information for all, with tailored referrals to those requesting assistance, and providing personalized navigation for those who desire additional support. This approach reduces barriers, respects privacy, and improves equity. In short, asking families what help they want instead of whether or not they have a problem connects more patients to services. For clinics building social care programs, it's important to prioritize resource menus, universal information, and the option for navigation support. Creating equitable strategies for identifying families in need and connecting them to resources can enhance a child's development, overall health, and success in life. Learn more about equitable social care strategies and how small changes to screening can make a big difference by reading our study. Thank you so much.